Welcome to K6 Wellness Revolution, where we believe health is worth fighting for. This podcast focuses on all things related to natural health, wellness, and vibrant living. We know your time is valuable, and I'm honored that you're spending some of it here. So get ready, because the Wellness Revolution starts right now.
Welcome to the K6 Wellness Revolution podcast. I'm Elena, one of the practitioners at K6 Wellness Center in Dallas, Texas, where we blend trusted expertise, compassionate care, and a passion for helping you achieve optimal health. Because wellness isn't just a goal, it's a revolution. Hey, have you heard about ozone therapy? This is an amazing treatment where they use medical-grade ozone, basically a supercharged version of oxygen, to kickstart your body's natural healing powers. Our bodies are pretty amazing at fixing themselves, but sometimes they get stuck. Ozone comes in with its reactive mojo and clears out those roadblocks, letting your body do its thing and heal. This isn't some new fad either. They've actually been using ozone therapy in European clinics and hospitals for over 50 years, and even at a moment in the US back in the early 20th century. So it's a big deal globally. There are professional ozone therapy groups in over 10 countries, and recently they even set up the International Scientific Committee on Ozone Therapy to nail down some solid scientific standards for it. The ozone therapy started picking up steam in the US in the early 80s and has been gaining traction ever since. And it's been shown to help with all sorts of conditions. For example, it can rev up your immune system to fight infections, improve how your cells use oxygen to help with heart issues or age-related problems, and even release growth factors that get damaged joints or discs to start regenerating. Plus, it's a game changer for chronic pain by calming down pain receptors. And studies have shown it can work wonders for things like interstitial cystitis, chronic hepatitis, herpes, dental infections, diabetes, and even macular degeneration. It's pretty impressive, right? And that's just a preview of what we have to cover today, so let's get started. I am joined by Sharon today. Hello, Sharon. I am sure our listeners have heard about ozone, and yet many people probably don't fully understand what it is or how it can be translated into a health treatment. So I know you will break this down for us. What is this thing called ozone therapy?
Well, ozone is made from it's the oxygen molecule. Okay, so oxygen is a single atom, and it's deficient in electrons. And this makes the atom very unstable. And as a result, you don't really find single oxygen atoms, floating around all by themselves, at least not for longer than nanoseconds. And so two oxygen atoms, though, will join together, and that's what you see, or that's what we experience in nature. And so oxygen as we know it is O2, or two atoms of oxygen together. And that's what's stable. Now, when an energetic force like electricity or ultraviolet light gets imposed on a molecule of O2, the two oxygen atoms will temporarily be split apart into single atoms. And then in a matter of nanoseconds, those very unstable oxygen atoms will pair up again, and then they'll go back to O2 molecules. But a small percentage of those will go into a ménage à trois that's known as ozone, or O3. And thus ozone, or O3, it's known as a molecule, and it's three oxygen atoms, but they share the same electrons, and there's just not enough electrons to go around to keep three oxygen atoms together for very long and very happy. Ozone's very unstable as well, so it doesn't last very long. The instability of O3 is why it is so powerful as a biological stimulant. And ozone is actually quite therapeutic. I think there are there's a lot of misunderstandings about it in general, but ozone is very therapeutic, and it can treat basically every factor that's involved in the cause of disease and aging. And it's important, though, that we understand that as we go forward in this conversation this evening, that ozone is a tool. Okay. It's not something that we use as a standalone or a cure all, but we do use it in conjunction with a lot of other treatments, and it does work wonderfully. Now, back to ozone, or O3. It's, like I said, it's when you get, electricity, or a spark of some, a spark of energy that creates the menage a trois, the coupling of three. Well, in the Earth's atmosphere, most of the atmospheric ozone that we have comes from Venezuela. It's from the Catatumbo lightning phenomenon, and it's over a lake in Venezuela. And that's the world's greatest source of natural ozone. So that's kind of cool to
It's
think
worth
about.
looking up. It is really cool. It's
Yeah.
really, really cool.
Yeah. I think a lot of people think that ozone is air pollution. It's like, no, that's not what ozone is.
Right. Well, and when we're talking about oxygen, it's long been thought by virtually every doctor that if you're breathing, your lungs are healthy, you are sufficiently oxygenated. However, not everyone's going to utilize oxygen the same way, so we can't really rely on this approach. What happens when the body doesn't get enough oxygen, and how does ozone therapy correct that damage?
Well, oxygen's really your most critical nutrient, right? But it's not just like what you take in, it's how you use it. And just like we say, you're not just what you eat, you're what you digest and what you absorb. So, same thing with oxygen. You're not, the difference between what you are at 20 and what you are at 70 is the efficiency at which you utilize oxygen. So the key to the treatment and prevention of disease is oxygen utilization. So the older we get, our oxygen utilization tends to go down. And that happens both locally, and it also happens systemically, or through our whole body. And so if you think about it, oxygen is needed for your organs to function properly. It's needed for you to be able to form cohesive thoughts. It's needed for digestion of food, for elimination of waste, for cellular repair, for reproduction, for your senses to function. And all of this, it all relies on oxygen. So you also have to have oxygen to make hormones.
Well,
That's a
oxygen
big
is,
deal.
yeah, it's pretty important. And, with all the genetic testing we do here, you've seen them with me. There are a lot of people who do not genetically use oxygen optimally. And that can be a big challenge when you're dealing with chronic illness, or if you're even dealing with fitness goals. Because if you don't have enough oxygen, you're going to feel it in all those areas that you mentioned.
That's true, because there are some people who are very long-winded and some people are short-winded. Like with runners, we got our sprinters and we got our marathoners, and oxygen utilization, right? Yeah. But aging and the diseases of aging, those are usually caused by lowered oxygen utilization. So when you have decreased oxygen utilization, you're going to have increased free radical formation. And increased free radicals, think not rush, rust. Free radicals, I always tell people, it's like oxidative stress. That's what causes oxidative stress. And oxidative stress is rust. So this leads to like decay and degradation of your mitochondria. And the mitochondria are what powers your cells. And some of your cells may only have one mitochondria, but some of your cells are going to have over 1,000 mitochondria. It just depends on where you're at in your body. Like your liver cells, they may have over 1,000 mitochondria. So how important are they? Pretty dang important. And they require a lot of power. So, if you don't have enough oxygen to power, what's going to happen? Well, your liver's not going to be working so great. And that's a big problem. So some clinical signs of decreased oxygen utilization could include sensitivity to cold, brain fog, fatigue, weakness, short-windedness, shortness of breath with exertion, exercise intolerance, generalized pain, decreased body temperature. Those are all things that really speak to not being revved up. And if you think about it, those also are things that we equate with a slower metabolism. Think about free radicals, right? Are they bad? Yeah, they are if they're not controlled. So how do we control free radicals? With antioxidant enzymes. And those are enzymes, like some of those are superoxide dismutase. There's a lot of them, like glutathione peroxidases and catalases. I'm not going to go into all of them, but those are things that convert free radicals into hydrogen peroxide and oxygen, right? So there's that magic word again. So that these antioxidant enzymes play a crucial role in helping you keep your cellular health. They prevent oxidative stress related diseases. They help with various cellular processes, cellular growth, defending your body against germs and pathogens. There are certain activities that these antioxidant enzymes can be influenced by. So things like age, how old are you? What's your diet like? What's your lifestyle like? What do you do? Are you active? Are you sedentary? What do you eat? Processed food? Things like that. So these types of behaviors and habits are going to play a big role in your biological age, if you will. And I think that's why we see young old people and we see old young people, right?
Yeah.
It's not just about the chronological age, it's about your biological age. And this is where oxygen is such a central part. And I think we overlook it, but it's those lifestyle habits, those dietary habits, it's what we do and how we live our lives that plays directly into how we use oxygen and how that oxygen determines how our health plays out.
So in essence, what you're saying, antioxidant enzymes are vital components of the body's defense system against oxidative stress, helping to maintain cellular homeostasis and prevent disease. So Sharon, how does ozone help mitigate this stress? And I'm sure you've got success stories you can already share. I mean, we've seen a lot of great things already.
Yeah. Well, ozone therapy has really come out as a revolutionary treatment option. It's not new. It's been around, like you said, definitely since people have been really touting it since the 80s, right? For as a treatment option for lots of conditions, and for people who have like chronic pain and infections, slow healing wounds. One of the most compelling uses for ozone therapy is how it helps to provide chronic pain relief. And just by enhancing or increasing oxygen delivery at the cellular level, ozone will help reduce inflammation instantaneously, and it can promote healing. And that makes it an effective alternative for people who don't find relief through conventional methods, be it NSAIDs or, other methods. I'll say even today, doing a particular ozone therapy that we'll talk about here in a little bit. had a guy come in and he had pain in a few joints, and I had done some injections using ozone as part of it. And the last time I did it, I just did these injections right under the skin. And he said, yeah, you told me it might take a couple of weeks, but really 3 days after you did it, my pain was down like
Mm.
50%. And I was like, whoa, that's kind of cool. And so I told him today, well, let's go all the way into the joint. And so we went all the way into the joint, and he walked out of here pain free. He was like, I
Amazing.
just cannot believe this. I can't believe this is completely pain free. And it's oxygen, right? So when you're
Mhm.
using ozone, it's an unstable molecule, but you're super oxygenating an area, and you're not using a medication that might have a bad side effect. You're just delivering oxygen. That's
Mhm.
it. So in addition to pain management, right? Ozone therapy is really good for treating infections. So it has really strong antimicrobial properties, which helps combat bacteria and viruses and fungi. And it makes it really helpful for addressing very persistent infections that tend to resist standard treatments. And
Well, yeah. I mean, yeah, I was just talking to a holistic dental hygienist today and talking about how ozone is very powerful in bacterias that have become antibiotic resistant. And we're just talking in a dental aspect, but you're talking systemic.
yeah. I had a dinner last night with a biological dentist, and she and
Mm.
I were talking about the use of ozone in dentistry and how much more prevalent it is just to help with the biome, the microbiome in the oral surface, because there's this idea that what's in the mouth is in the gut, and what's in
Mhm.
the gut is in the mouth. And so keeping it clean, right? Not sterile. We don't want it sterile. We want it clean. And ozone is really helpful for that. And even with wound healing, right?
Mhm. Sure.
Um, ozone can really shine. So there are so many ways to deliver it too. Whether we're injecting or insufflating, which is forcing air into an area of the body, we can inject it, subcutaneously, intramuscularly, subdermally. We can go deeper into the body, but we can put it up the rectum. I mean, if you think about the intestinal tract of the body, well, we say 70% of the body's immune system is in the intestines. That's also where a lot of problems happen for people. I mean, how many
Mhm.
people are constipated? How many people have, dysbiosis or an
Yeah.
upset to the intestinal flora or microbiome?
Yeah.
And when you put ozone in there, you're able to really help balance out the flora and take care of a lot of bloating issues and help regulate issues. And there are people who have really bad gut infections who report, wow, my colitis, my Crohn's, my gut infections feel better. Now, I'm not making claims. I'm not playing doctor. So back off, people. This is educational.
But but the point is it's helpful with so many different conditions. And
Yeah,
interesting, you know this, ozone's relatively cheap and it can't be patented. I feel like if it could, it would be
it would be
used
used more.
everywhere in every medical field, holistic or Western. But
Yeah.
with growing numbers of people who are experiencing these debilitating symptoms and degenerative disease, I know we're going to see more people looking for these out of the box approaches. And you went through some of those conditions, but I mean, it extends to all types of autoimmune disorders, as well as what you're saying, like cancer. Now, it's not an end all be all, but it can be used for so many different things there.
Yeah. And it's interesting, even with cancer, because they'll say, don't do any antioxidants or, whatever. Don't do
Mhm.
anything while you're doing chemo or radiation.
Mhm.
And I hear doctors all the time talking about their patients doing antioxidants or ozone while they're doing radiation or chemo, and they get through it faster and with better success than the standard patient. It's kind of interesting, you know.
It is.
So if Western medicine truly had open minds, I think we'd be a lot further along in healing people. But it's pretty interesting. But oxygen it's just so fundamental to why people get sick, or I guess the lack thereof.
Yeah.
Why people get sick, how the body heals. And ozone therapy has just been found to be so useful for so many conditions, including heart disease, chronic fatigue, fibromyalgia, herpes, hepatitis, interstitial cystitis, which is hard to heal. Interstitial cystitis is difficult, but diabetes, Lyme disease, chemical sensitivity, macular degeneration, intestinal disorders, autoimmune disorders, but decreased oxygen utilization is the primary cause of degenerative diseases. And the treatment of all diseases, including aging, if you look at aging as a disease, and autoimmune disorders and cancer and cardiovascular diseases, is to optimize oxygen utilization, right?
Yeah.
That's why ozone therapy can be used in virtually every patient you see, because who doesn't need a little more oxygen? And even when we use thermography, we can tell who doesn't breathe, right? We can tell whose brains aren't getting oxygenated in the way that their body thermoregulates or doesn't.
Yeah.
And how many times do we have to take people through breathing exercises?
Yes. I mean, just for anxiety or focus, if you get more oxygen, you're going to be calmer and you're going to think better. But, with such a wide array of conditions like this that ozone can be used for, this therapy could be a very helpful tool for people, especially like I'll use myself as an example. I have airway dysfunction. If you have a lifetime of low oxygen, your entire body's going to take a toll for it. And ozone won't fix the airway, but man, it sure could help compensate for the lack of oxygen in cells and tissues, lifetime, which leads to autoimmune disease if you don't have enough. So it's a powerful tool to be able to use that while you're fixing the problem, while you're addressing the root cause. You can get a little more life back in your step if you have more oxygen. And I know other practitioners that generally utilize ozone, like we mentioned, biological dentists, they recognize the benefit of using ozone for infections, but they are limited in what they can do with it. Medical professionals like you, Sharon, you get to use it in a variety of ways. And you talked a little bit earlier about some of the different ways you can deliver it. But you want to tell us a little bit more about how and when you would use the different deliveries?
Yeah. So, practitioners who are trained can administer it to the blood. We can put it in joints, in the spine, body cavities, such as the bladder, the rectum, the ears, the nose. I mean, you got an orifice, we can fill it. The intestines. There's so many avenues of application for ozone. Even on the skin, there's something called limb bagging, right? Where I've seen gangrene. I've seen the pictures of gangrene be addressed and treated with ozone. It's just unbelievable. So yeah, you can inject it, you can insufflate it, which means blow the air in some way in the body in an orifice. You can diffuse it into liquids like oils, glycerin, and water. And but the most effective way to maximize the effects of ozone therapy is to combine it with other therapies, aimed at eliminating the causes of decreased oxygen utilization. And it's noteworthy to interject that even according to the Journal of American Medicine, or JAMA, and the New England Journal of Medicine, the correct use of medications continues to be the third leading cause of death in America. So let that sink in for a minute. The correct use of medicine continues to be the third leading cause of
That's
death
wild.
in America. And there just has to be a better way. And we need to have a better paradigm than cut it or drug it.
And you would think in the year 2025, the cut it or drug it approach would be outdated, but here we are. And thankfully, we have more and more alternative tools at our fingertips in the functional holistic world to help with healing and longevity. Now, I know you can do even more with ozone, especially when incorporated with other remedies. So tell us about Prolozone. I find this one so exciting.
Yeah, I think Prolozone's my new jam.
Yeah.
Prolozone it's an injection. Okay. So it's a combination of ozone, sometimes a homeopathic, some B vitamins, dextrose, bicarb, and saline of sorts. And it was developed by Dr. Frank Schallenberger. And he's kind of the godfather of ozone. And he's an amazing guy. It's excellent for really all forms of musculoskeletal and joint pain, including chronic neck and back pain, rotator cuff injuries, degenerative and arthritic hips, knees, discs in the back, shoulder and elbow pain, wrist pain. So basically, like when I do it, whatever joint I'm going into, it is intra-articular. I'm going into the joint space and I inject the solution that I just talked about. And then I inject ozone gas behind it. So you inject the solution, then you inject the ozone gas. And if there's been an injury like a tendon or ligament or cartilage, a lot of times we'll go in behind that and do PRP on top of it. That's not part of Prolozone. That's just extra.
It's a little bonus.
Yes, it's a bonus. So you get some repair. But the really cool part of Prolozone is like people come in and you ask them, a scale of 1 to 10, where's your pain? What movement triggers the pain? Show me, rate it. And then you do the injection. And most of the time there is significantly less pain or they're pain-free when they walk out.
That's amazing.
And you just don't get that. And there's no steroid in it.
Yeah.
So we're not, if you do steroid injections long term, you're breaking down your joint. It's not good for you. There is nothing degenerative in a Prolozone injection. It is only regenerative.
I love it. I mean, it's been so much fun to witness our clients firsthand who are getting that relief. It's truly an amazing therapy.
Yeah.
And, like you kind of said, there's not a lot that gives you that almost instant relief.
Yeah. And there's a 75% chance that chronic pain sufferer is going to become permanently pain-free.
I love it. I mean, it's non-toxic, easy to use, fairly cheap, and has such a positive effect on all these different joint conditions that you mentioned. However, I'm sure even with ozone, there could be some side effects. What could those side effects be, or what contraindications are there with ozone therapy?
Well,
in all the deliveries.
Yeah, of course. Right. So you got to be careful with everything. So contraindications first. The main one with ozone, or especially like Prolozone, there's a specific condition. It's known as G6PD deficiency or glucose 6 phosphate dehydrogenase deficiency. And that is, it causes your red blood cells to oxidize, and it could lead to hemolysis or, destroying your red blood cells. So we don't want to do ozone on people like that. And then we're just not going to do it on pregnant women.
Of course.
Just in general, because you don't do anything to pregnant women. People who have uncontrolled hyperthyroid probably, we're going to at least be super duper careful with them, but I don't know that that's something we really want to start. um I wouldn't, but some other practitioners might. And then if you have somebody with an acute bleeding or hemorrhagic disease, um, ozone therapy might increase the bleeding risk. And if you're doing ozone IVs, we're using heparin, as an anticoagulant to make sure that the blood's not coagulating. So you have to be real careful with that. People who have cardiovascular conditions that are unstable, I would not really want to.
Mhm.
I mean, you're not going to give it to somebody who's in the middle of a stroke or a heart attack,
Right.
obviously, right? So, and then people with blood clotting disorders, I think it's just really important to know people's histories, if they're on blood thinners, if they have hemophilia. We want to know all of those things. And then people who are severely anemic, or if they're recovering from a hemorrhage, that's important to know too. And then people with seizure disorders, or if you're like acutely intoxicated with alcohol, I mean, hopefully people would know that.
I don't think they'll be coming here anyways, but just in case someone's wondering, there you have
Yeah,
it.
don't go drunk to get an ozone IV. Maybe go get the hangover IV, but
Right.
that would be it. And then some people are intolerant to ozone. Um, it happens now and then. And then there are people who are just in a terminal state. And so that would be something that needs to be decided with their provider,
Sure.
whether or not they're going to do that. And then people with decompensated heart sufficiency, that would be something to look at too. It's really important to give a full and honest health history to your practitioner and really look at what your health needs are, and make a good decision about ozone therapy, especially if you're doing like the IVs, because there are a lot of different kinds of ozone IVs that we're not really going to touch on in the context of this, just knowing that there are ozone IVs and they're all amazing and they do great things, but make the decision, is it good for you? But there's always other delivery systems and they're very user friendly.
Yeah. Well, and all that said, this treatment can be applied to so many people who experience, such a variety of ailments. All the more reason, work with a qualified health professional. Please do not biohack this on your own. You need guidance on what is going to be the best therapy, the best delivery for you and your condition. So just make sure you're working with someone who really knows what they're doing.
Yes. And I
And
want to say
Sharon
one
is
more
one of those.
Yeah. And I want to say one thing. So, and I've had a few people say this when we talk about ozone and ozone water, ozonated glycerin, and people buy these ozone discs that they clean their vegetables with. And that's great. But that is not what we're using in a medical office
Right.
to provide ozone therapy. So please do not think that you're going to buy one of those and do ozone therapy at home, because you really don't know what you're getting. There's a lot to ozone therapy. We're using medical grade oxygen. We're controlling closely the level of the dose, because
The
dose is
concentration.
the
Right. The concentration.
concentration. Yes. The dose that you are getting is controlled based on how it's being delivered. And, yeah, your vegetable washer can't tell you that.
Yeah.
And so it's better to work with a professional who can reliably provide you a quality service with an expected outcome. And if you were to have an unexpected, side effect, they can help you through that.
Because it's going to
Because
happen. There's
yeah,
always someone. There's going to be someone who does have a little reaction, and you want to make sure you're in a safe place where your practitioner knows how to help you through that.
yeah.
Yeah.
Yeah. But
So,
because the benefits from ozone therapy are so good that it's really something, if you have any kind of chronic disease, autoimmune, inflammatory condition, it's a tool to put on board, whether you're doing, gosh, name it, Elena, whether you're doing PRP or
yeah.
exosomes or,
Mhm.
any of the things, it's
Compliments.
amazing.
Yeah. So what ozone therapies or treatments are you most excited to be bringing to K6? I know we do a lot, but do you have a favorite?
I mean, I have to say I love needles, and I've always said, everyone laughs at me. I'm like, I'll stick a needle anywhere.
I've seen it. I know.
I love the Prolozone. I love the joint injections. Those are so much fun to me because I love seeing people get up off the table and just be pain free.
Mhm.
And that's just an amazing thing. So I am really excited about that. And the major autoimmune therapy, the MAH, just the ozone IVs. I think those are so much fun. So yeah, I like all the ozone. And it's fun to, blow it in somebody's nose or up their sinuses and in their ears and send them home with an enema bag full of
Yeah.
ozone so they could do it in the privacy of their home.
Mhm. Well, there's just a lot to embrace around ozone. And I think there's probably an ozone solution or therapy for every single one of us out there listening. And we love having these conversations. I always hope, Sharon and I always hope that today's episode gives you new insight into how ozone therapy, this supercharged form of oxygen, can help jumpstart healing for you and enhance oxygen utilization and support the body's ability to regenerate and thrive. Don't forget to like and subscribe us if you're watching on YouTube, and follow us on Rumble, Facebook, LinkedIn, and Instagram for more wellness content. If you're ready to explore these advanced therapies and personalized care, please visit k6wellness.com to learn more or to schedule a free discovery call. Until next time, take care, be well, and as always, your health is worth fighting for.